Good evening, everyone. Hope you all are doing well. I am Arushi, coordinator from NurtureLife, and thank you all for sparing some time from your day to day to attend this workshop. This workshop is a part of Uttar Pradesh chapter that is being conducted by Fahima Rashid ma'am. Just to brief you about the organization, NurtureLife is a non-profit organization established with the aim of providing solution to the mental health issues which are prevalent in our society. It is founded by Mrs. Farah Sarosh. NurtureLife is based in Lucknow that works in the field of mental health. We are working pan India and in the US, KS, Nepal, and Bangladesh. There are so many people struggling with mental health, which may be in your family, teaching your children, living next door, your friends. And Nurture Life is trying to break the silence around it. Nurture Life is also a movement which explains that people experiencing mental illness or negativity in their life are not alone and that there is always a ray of hope. So before we start the workshop, I would like to share some brief instructions that has to be followed during the workshop. This is an interactive session, so you all are free to ask your questions to the speaker. No disturbances should be created during the workshop. If anybody is found creating disturbances, they will be blocked and no participation certificate will be issued to them. And lastly, the certificate will only be issued if you will attend the full workshop. Now, I would like to introduce the speaker of today, who is Dr. Syeda Ruksheda. She is a psychiatrist and a psychotherapist with over 20 years of experience specializing in adolescents, young adults, women, and families. She's trained in esteemed medical institutes of Mumbai, with a WHO fellowship from South Korea in psychosocial rehabilitation. A celebrated speaker on mental health, she has two TEDx talks to her credit, among various other appearances in media. She serves as a co-chair of Women's Mental Health Specialty Section of Indian Psychiatric Society and National General Secretary of Indian Association of Biological Psychiatry. So without any further ado, over to you, Saida ma'am.
Thank you so much, Arushi. Very sweet of you to introduce. And I will again at the outset apologize because I've been doing a lot of back and forth with her, and she was very kind and very patient with me. So thank you so much for that. Good evening, everyone. It's really nice to be on the webinar today with you. I do kind of break into monologues, but we definitely have enough room and space for a dialogue as well. So don't worry about it. Arushi, if I could just request you to let me know when it's 5:30, so then I know that, okay, I'm pacing myself because sometimes I forget to watch the clock.
Absolutely.
Start my screen share now. We'll go ahead with this. Right. Yep. All right. So today we're going to talk about anxiety and its management. I'm Dr. Syeda Ruksheda. I'm a psychiatrist, born, raised, and trained in Mumbai. It's in my blood. Right. Sorry, I do get startled a little bit when there is a sudden disturbance. So pardon me for that. I'm really obliged to the organizers who thought that I'm good enough to come and speak about mental health and anxiety today. So thank you very much. Of course, I cannot not acknowledge my parents and all the patients who've already, been teaching me over the last so many years. Special mention to my colleagues because I got really lazy and I was like, listen, I don't want to make slides. And they were very sweet enough to send me a few slides. Dr. Monali Deshpande and Dr. Cheryl, very, very sweet of them. There's no conflict of interest. Nobody pays me anything to say anything. Everything that I say is evidence-based, data-based. If it's something that it's an anecdotal, or if I say something, I generally tell you this is what I think, which I mostly don't do. Disclaimer, I talk too much, and that GIF there is absolutely me. Right. All right. So when we talk about stress, we generally think about it in a very negative connotation. Stress matlab bura hai, right? So, but we also need to acknowledge that there is no movement in us as human beings or in our world around us if there's no stress. So a certain amount of stress is normal, right? Even if it's like, oh, I have to get my food, made in time, or oh, I have to dress appropriately for the webinar and things like that. So it can lead but it can lead to us to act either on our concerns, or also like protect us from harm, isn't it? I mean, I know that okay, if I do this, it's going to be harmful for me, so I might avoid doing something. So stress is not harmful in itself, and of course, when it's too much, or it's going on for a very long period of time, or if my coping skills are a little less, of course, it can hamper. But stress in itself is not a problem, and because it does, we do need it for our survival and an adaptation. And we do it, just kind of, it does have an impact on us that most of us know, which is fight or flight, isn't it? So if I see a tiger, I'm going to figure this out. Okay, am I going to stand here and fight against it, or am I going to run for my life? So either one situation might not turn out to be very great, but at least that would be my instinct, and that's what's kind of saves us from danger, isn't it? So when we talk about anxiety, on the other hand, right, it is again one of the more, it's a common kind of a feeling or a thought or a sensation in our body. Almost all of us have gone through life with feeling some anxiety. Like if I have an exam tomorrow, and for if I'm feeling a little anxious, that's perfectly normal and natural, isn't it? And because I kind of remember that, the next time I'm going to kind of think that no, 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 last time I wasn't prepared. So I was very anxious. So this time I'm going to prepare myself a little better. So a little bit of it is again very, very natural. Unfortunately, a lot of us do feel that at a level of distress and at a higher level of a disorder. So we do say it's a health issue, right? It's not something that, oh, it's just in my brain, or it's just in my mind, because our mind is part of our body, it's part of our body functions of a daily basis. So if there is something that's going on wrong with me, with one part of it, and I'm anxious, of course it's a health issue. And that's something I think somewhere a lot of us are only now beginning to kind of accept, that yes, mental health is also because of, like, it's a body function, and how it's important for us to kind of take care of it, and how a disturbance in mental health is a health issue. So we're just now kind of getting around to it, and talking about mental health is getting normalized. So we're good about that. So that's why also I think we can start today's session at a level where we all have a basic understanding of certain things, isn't it? So that's a good thing. So it's, it's like, when you're describing anxiety, a lot of us will identify that as tension or worried, or it's thoughts, or like something in my tummy, or it's triggered my migraine, or I have to go to the bathroom often, and things like that. So there are physical symptoms of it, there are emotional symptoms of it, and there are thought symptoms of it. And usually people with an anxiety disorder will have these kind of symptoms on a regular basis, and they're intrusive. Even if I don't want to think about certain thoughts, or I don't want to feel certain things, they're going to be involuntary, and they're going to be intrusive. And that does kind of make me avoid a lot of things. So I will feel that no, 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 if I get anxious, if it's in a big crowd, I don't want to do that, so I will stop traveling for work, or I will stop going to workplaces that are very crowded. Going to college or school or workplace is very, very daunting and intimidating and difficult. And there may be, of course, so I start avoiding those places or those situations. And when we're talking about, sometimes people don't recognize that this is anxiety, because they will have physical symptoms, and they might not have so much of anxiety as a feeling or a thought, but they'll have tremors and sweating and palpitations and breathlessness. So a lot of times people think, is it asthma? Is it a heart attack? Why am I feeling so anxious? Like, why am I feeling all of that? So it's going to be, so like I said, there are physical symptoms, psychological symptoms, which includes thought as well as emotions. Um, uh, Let me just start with everybody here. And if does anybody want to share at this point, if they themselves, or if somebody they know, have suffered from anxiety, whether it's just anxiety or they've been diagnosed with an anxiety disorder? If anybody wants to share something, like I said, could be about you, could be about somebody you know. Yes, Ariba. Um, I thought she wanted to say something.
Shiva, would you like to say something?
No, she's on mute again. So it's okay if you guys don't want me to do a very interactive right now, and we can do just like a question answer and a discussion later. If that's comfortable with everybody, I can just get on with my presentation. Is that okay? Okay, I guess so.
Yes, ma'am, I know a person who is suffering from anxiety problems.
Right. Um, right. So I'm sorry I missed that. Who said that? But do you want to share
It was
something
me.
about that case?
It was me.
Right. Do you want to say something about it? Do you want to just tell us what happened to that person? What was the person going through?
It's just she doesn't want to face many people because she gets nervous. She has palpitation issues, and her confidence level has gone down because of the problem.
Sorry, what levels have gone down?
Confidence level because of the
Level has
pain.
gone down. Yes, yes. So thank you very much for sharing that. And like, just now how she described it, it not only is making that person feel distressed, but it's also impacting everyday life where the confidence level, it may start off with one aspect of our life that maybe I feel that my confidence level at my work has gone down, or maybe I might feel that my confidence level with interacting socially has gone down, but dhire dhire it's going to kind of like, I am going to overall just feel less confident and not be able to do anything. So the way we call it is socio-occupational deterioration. So yeah, that happens. So I'm just going to go ahead with, try rush with the slides. I do have a lot of them. Right. So when we do talk about anxiety on a larger scale, if we're talking about only anxiety and panic attacks, right? Anxiety would be like a generalized anxiety where I kind of feel anxious throughout the day. There's no particular reason or anything, but I'm just a little anxious. Then I have panic attacks. Panic attacks are these short episodes lasting anywhere from 15 minutes to 30 minutes, where there's a gradual increase in my symptoms, and then I'm very distressed, and then there's again a gradual tapering out of my symptoms of palpitations and breathlessness, and all of the tingling or sweating or fainting, fainting, or the other kind of bodily symptoms. So some people have generalized anxiety disorder, also have panic disorders, and a lot of the times there are different varieties of anxiety that may not be to some, like I said again, to at a distress level or at a disorder level. People who have social anxiety, where they feel that they can't talk because if everybody's judging them, and they want to, that's why then they isolate, don't mix with people, especially when it happens to younger people and teenagers and in school. So they develop social anxiety, and because of it, there is a lack of social interaction, and further social development is not happening, isn't it? Then there are, of course, situational anxiety, like we'll say, um, um, crowded situations, or performance anxiety, where there is, if I have to give a presentation, or sometimes, so situational anxiety and performance anxiety could also be when, if I'm anxious during exams. A lot of times there's exam phobias or exam anxiety. Phobias are again very situational. Ordinarily, I'm perfectly fine. The minute I have to travel, like in a small space, like a plane, or maybe even an elevator, that's when I can get very, very panicky. Or if I have a phobia of heights, or if I have a phobia of darkness. A lot of the times we do see young children having a lot of phobias, so they do need a light night or night light on and things like that. Sometimes a lot of people have phobias of needles. I think recently there was this video clip that went off. This person was very petrified of needles, and she was sitting there and still getting the COVID vaccine, and the person, maybe her male partner, was standing there, like being supportive and being there. And so it was a very sweet moment to see, but also a lot of us could identify with something like that, isn't it? um, so when we talk about social media, because these are newer kind of phenomenons that we see, that we know that there is, especially in younger people, but you'll be surprised how many older people also have this fear of being without a mobile phone. Nowadays, frankly, the younger people are so much more better with not having access to their phone or not using their phone for some time. In fact, they're so much better in detoxing themselves. It's the adults, if I tell them that, okay, you have to spend today without your cell phone, they get absolutely, jittery and scared and anxious, because for some, most of them hadn't even thought that could be possible. And also a lot of the times, especially people who are very engaged in social media and who kind of have a life on social media. So they're forever worried that, oh, am I missing out on something? So these are again some newer kind of phenomenons that we are seeing that we probably didn't see 10 years ago. Then there are, Facebook depressions and cyber chondria, where when we are seeing something on social media and the lines between fiction and reality gets blurred. And if I see something on Instagram and I see, oh, my friend is having this much fun, or my, or somebody else post got so many likes, and that makes me feel sad and as if my life is not great, or or I don't look good enough, and body image issues and things like that as well. So these are, again, like I said, a little bit of a new age thing. um, why do we talk about anxiety? Why are we here today, right? Apart from just like, oh, sabko sab kuch malum rehna chahiye. Because, and when we say it's a health disorder, right, it's a health burden, it's a health problem, is because there are so many of us suffering from something like this, isn't it? 1 in 5 of us have had a episode of depression or anxiety at least once in our lifetime. So that's a huge number. And anxiety can be a little chronic, and it can take a long time for it to get better, because so we see that a large number of people amongst us, the globally or in our country, are suffering from anxiety, and that's why we need to take care of it. Of course, when we do see like there's a slight increase in female population than in male population, not only because, oh, genetically they're more predisposed, not at all. What happens is that when we talk about impact of the stressors on mental health, women are subjected to more amount of stressors, and that's why probably there are more number of cases reported. Also, women are better at taking help when they think that they need to, and men feel that still there's a lot of stigma in men as far as mental health is concerned. So that's another few reasons behind all of this. A lot of myths about anxiety. It's not real, it's not an illness, it's all in your head. It is a disorder. It is a common mental health illness. It's a common mental illness. That means like depression and anxiety would be common illnesses. That means there are more number of people suffering from it. Also, that they are not as severe as other psychiatric illnesses like schizophrenia, bipolar, OCD, and substance abuse, which let's say schizophrenia is about 1%, bipolar is about 2%. So they are more chronic and they are more serious conditions. So anxiety, when I'm first diagnosing and I'm kind of like trying to break bad news, I'm like, अरे नहीं, this is a common psychiatric illness, बहुत लोगों को होता है, आपको भी हो गया, ठीक हो जाएगा. So, but it's definitely an illness, and we don't want to kind of overlook it in ourselves or the people around us. Common myth is that everybody gets stressed out, it's normal. Like we started, yes, everybody gets anxiety in certain situations. Momentary anxiety in certain situations is very common. But when we're talking about distress or disorder, then we're talking about people who are having worry and stress on practically on a daily basis, very intrusive. We can't really move our focus from away from it. Another myth is that too much anxiety will give me a heart attack, right? But which is not true. It's a completely different kind of like a system. Though when you're getting a panic attack, it can mimic a heart attack, and it's one of the most awful things that somebody can suffer through. So I think we should all have empathy for people who have anxiety, because very often I will get a patient saying that, हाँ हम गए थे, हमको डॉक्टर ने कहा आपको कोई प्रॉब्लम नहीं है, आप साइकाइट्रिस्ट को दिखाओ. So I'm like, please, we all need to stop saying that. Anxiety is and I do tell people that like I said, when I'm trying to break bad news, I'm trying, I tell them that हाँ ये बीमारी उतनी बड़ी नहीं है, उसकी तकलीफ बहुत बड़ी है. So I think we all need to be a little empathetic towards it, because when somebody is complaining of this, they're like, oh, this is just anxiety. But yes, but that person is going through the same, practically the symptoms like somebody who would be going through a cardiac arrest, isn't it? So I think it's important for us to, yes, agree that this is anxiety, but also agree that it requires the same amount of kind of concern and care, isn't it? Um, there's another myth that, oh, they just need tranquilizers or sleeping pills. That's not true at all. Though we do use tranquilizers and sleeping pills, they're not really, I mean, for the lack of a better word, we are using those words right now, but they're not that at all. They are proper medications that are evidence-based medications that are definitely therapeutic and used to effective use in anxiety. But again, those medications that we use are for short term, 2 4 weeks, maximum 8 weeks, because we do not want to give sedatives or tranquilizers on a long period of time. Another myth is that if you have anxiety, you should avoid all stressful situations. So what happens is people, also try to, they set you up, like they start you treating you with kid gloves. कि उनको कुछ मत बताओ, उनसे सब कुछ छुपाओ. That also increases irritability and feeling like helplessness. Ki don't treat me like a child, or don't keep me out of it, or some people might use that as a secondary gain. No, 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 I have anxiety, don't tell me anything, right? So again, there is a disadvantage and an advantage that people might inadvertently take of a disorder. So we need to be, that's why also it's important for us to understand from a medical perspective, because just because you have a illness does not make you invalid in terms of everything else, isn't it? So avoidance, in fact, like suppose if I have a phobia or a fear of crowded places, so avoidance of crowded places is not really then allowing me to learn to cope with them. So again, to completely keep me away from a situation, especially that I think is going to trigger me, is not the right way of doing it, because then I'll never kind of, my brain is never going to be okay with that. Okay, even if I go in a crowded place, I should be okay and I will be okay. It's always going to shun it. And the minute there is a crowd, my brain and my body might shut down. A lot of the times, unfortunately, we see people that, oh yeah, I'm anxious the whole day. I come back and I just take that peg dog and I'm fine. And that's absolutely the wrong thing to do, because whether you're using alcohol, or whether you're smoking up a joint or marijuana, or whether you're using some kind of medications like sedatives and things, which you might get it from a friendly neighborhood pharmacist who's breaking the law by giving you medications without a proper prescription, all of these self medications are doing you no harm. They're increasing your anxiety disorder and not really helping you get better. So you do want to make sure that you're not self-medicating. If you feel that you've been struggling for some time, it's better to go see a professional and a psychiatrist than decide to do this on your own. We have, like, some people say that depression and anxiety is like cat on, fur on cat. When there is anxiety, a lot of the times we do have secondary depression. Some of the times we have both depression and anxiety. So they kind of like go hand in hand in a lot of the times, because if I have anxiety disorder for a long period of time, that can also trigger depression as a disorder. A lot of the times I have both symptoms of anxiety that start at the same time, because the genetic vulnerability, the genes that are involved are similar. The brain areas that are involved are similar. The neurochemistry that is involved is similar. So a lot of the times we do see that they happen together. So we were describing symptoms of anxiety, symptoms of depression can be mood swings or low mood, crying spells, lack of any pleasure, even if they're doing something that's exciting or interesting to them, not being able to focus on work, memory issues, feeling hopeless, helpless, worthless, in certain cases, even suicidality. So those are symptoms of depression. When do we say that, okay, you might have depression or anxiety for that matter? So when you have these kind of symptoms that are different from your usual pattern, and you've noticed them more consistently and they've been lasting for more than a couple of weeks, you might have some certain disorders that you want to get screened and then diagnosed. So we do have, like I said, a lot of the times depression and anxiety going hand in hand. So it's important. So we never talk about anxiety without also talking about depression. What do we do? How do I take care of my mental health? So I always tell people, mind is one function of my brain. Brain is an organ which is a part of my body. So a healthy lifestyle which is good for my body is also good for my mind and mental health, right? So, and a good lifestyle, a healthy lifestyle, is not treatment for a disorder. Just like, suppose if I have diabetes, and I'm eating well, I'm exercising or going for my walk, does not mean that I don't take my insulin, isn't it? So the same way, when we are talking about a healthy lifestyle, that helps in recovery. That is part of your treatment plan, not the treatment plan. So it's very important for us to remember that, because very often, because we will advocate, like I'm a psychiatrist and I will advocate, oh, exercise and yoga. A lot of the times people think that, okay, that's the treatment. It's not. It's part of your healthy lifestyle, which is good for you to have, so that you can then kind of get better faster and remain better. So it, like, even if you don't have a distress or disorder level of mental health challenge or issues, great. Then it's important for us to have a healthy lifestyle where there is a balance between my I'm having a balanced meal, I'm sleeping adequately. Some people might require 6 hours of sleep and some people might require 8 hours of sleep. It's very important for me to do that. Sleep is again a very important aspect, because a lot of the times, like last night I slept off early, and for me early is midnight. 12 o'clock I was off, right? Unfortunately, like, A, I'm from Mumbai, everybody sleeps late here, but B, anyway, I work late in the night because that's where I can creatively function better. But 12 o'clock I slept off, and then I slept for a good 9.5 hours. For me, that's not my normal sleep. I was making up for my missed sleep from last week. So this was a sleep deficit that I was repaying. Unfortunately, that's not a good thing. Now, in my case, it wasn't my fault. The night before that, we had huge thunderstorms, and I don't think anybody in Mumbai could have slept through that, and I didn't either. So I kept going off to sleep, and I kept waking up with the noise of the thunder. It was beautiful, the nature. But having said that, yeah, it was loud, and I couldn't sleep. So when we talk to people about adequate sleep, they say that, oh, Saturday, Sunday I sleep a lot. No, you're not sleeping a lot. You're making up your sleep deficit, which is not good for your body. It's like, okay, I'm going to starve Monday to Friday, and then Saturday, Sunday, I'm going to eat. That's not how your body is going to function, isn't it? So that's not what you can do with sleep as well. So you have to start listening to your body in terms of how much sleep it requires, what kind of food it likes. You're not going to feed your body peanuts if you have peanut allergy, isn't it? And the same way, exercise is very important again, that you do the kind of exercise that suits you, that suits your system. Especially women with PCOD, they can't just go to the gym and start pumping iron. They can't do that. That's going to increase their PCOD, right? So it's important for you to listen to your body and then respond accordingly. Um, it's important to have some time to yourself, right? This is apart from the meditation or the relaxation techniques that you will do on a daily basis. Like I was speaking to a medical student yesterday, the day before, she was saying that how, oh, for 30 to 40 minutes of meditation really helps her. I'm like, great. Now, she's also appearing for exams. So she doesn't have 30 to 40 minutes on a daily basis, because she also has hospital, and then she gets tired, and then she has to study. So the lack of motivation, even if she has the time for, those 30 minutes, she doesn't have the motivation or the willpower to do it also. So then we say that, okay, yes, we understand this works for you, but let's break it down into 5 minutes, 3 times in a day. Just do a little bit of relaxation exercise, and that's going to work beautifully as well. So we need to be practical about our healthy lifestyle. Be sustainable for us based on what our requirements are, isn't it? So if we do that, then first, the minute I start talking about, oh, healthy lifestyle, a lot of people, especially people going through depression, like, they just feel dejected कि ये मुझसे नहीं होगा. I've tried it, nahi hota hai. I do it for a week, and then, like, it's all like back to square one. So we don't want you to do that. We're encouraging you for a healthy lifestyle that's suited to you. If you don't know what to do with your life, maybe sit down with a general physician, sit down with another medical professional, and figure out what fits you the best, isn't it? Even when we go to nutritionists, we say that, no, no, you're telling me to eat vegan, but I can't do that. Or you're telling me to eat, vegetarian, but I don't want to give up my non-veg. So you do need to work with your body and work with your life and make it a sustainable lifestyle. Some amount of pleasurable activity to zaruri hai. And all, like, you need to have a little bit of fun. Um, so even if it's like a short period of time, even if it's like 10, 15 minutes on a daily basis, where you're watching something online, or you're speaking to people that you like, or you're just going out and meeting people, which please don't do during the pandemic. But that way. And like, humor is again something that's very easy to, to kind of relieve a lot of your stress. So you'll catch me like, watching 3 minutes, 5 minutes of those stand-up comic kind of videos and it's really nice. It kind of refreshes you and things like that, isn't it? And when, when we talk about no stress, having a positive attitude, again, a lot of people think that we are saying that all is well, all is well. No, 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 that's not what we mean by positive attitude at all. Like I was just giving an example in another talk that I was giving last Sunday. It was a terrible day. Like, something happened in the family, and I was like, "Ugh," and everything was like really, it was a very, very bad day. Right? It took me, in fact, like a couple of days to get over it as well. Having said that, Sunday night when I was just kind of like, thinking, I was just like blah, doing nothing, and I posted something on Instagram, and it was a very positive post. And so I was telling people that, see, I had a bad day, but at the same time, it wasn't as if I'm thinking that my life is bad. Right? So yes, I had a bad day, but my life is good. And yes, I'm going to take a couple of days to get over whatever happened, but my life is good. That's positive. So I'm not going to say life is great, everything's perfect. No, it has to be a very reality based approach. Yes, this is an issue, but we are handling it in this manner, and hopefully it will get handled. And yes, overall life is good, right? So when we talk about, having a gratitude diary, and which is something that again we recommend, that is very good for you as a lifestyle habit to inculcate for avoiding anxiety, even helping yourself with anxiety and depression, is again not something that, okay, everything in your life is good. Having said that, there's still something in your life that is going to be good. So earlier in the day, I was conducting my support group for young people. We do that once in a month, every second Sunday. And that this gratitude journal kind of came up again because one of the young people, he was sharing that this is what he does. So what the way I would recommend is that like the gratitude journal on down, because and one part of the gratitude is all about, okay, my life is good, I have roti kapda makan, that kind of a thing, that, oh, I'm grateful to this, I'm grateful for that. Whether you're grateful to God, whether you're just generally grateful, that's fine, anything is okay. And the second part of the gratitude diary has to be something that what happened today, what were you grateful for today. So that again, sometimes, people are like, हाँ मतलब क्या कैसे क्या लिखूं. So then again I break it down. So I'm like, okay, what was a good moment, what was a moment that you was like, it was nice, something that you did, right? So let's say maybe I made chai for people in my house and it turned out to be really nice and they were very happy about it. So that's something that I did, and I was like, yeah, that was a good moment in my day. Something that somebody did for me, कि मैं बैठी थी, I was busy in my clinic and my assistant just came and gave me a cup of tea without really even asking me. Something somebody else did for me. Yeah, that was a good moment. And the third thing is something that I may have observed. I may have seen, like, something that, oh, I looked outside and it was raining the last few days, everything's green and there are birds chirping, or something that I may have observed. Now, if I do this gratitude diary on a daily basis, then my brain is just primed for picking positives from my day, isn't it? Because then it's like, अरे यार ये रात में homework करवाएगी, start looking at things, right? Because अगर रात में मैं बैठ के सोचूंगी यार gratitude diary के entry में क्या लिखूं, what am I going to write today, that's going to take more effort. So the brain is like, पहले से ही सोच लो, right? So then I'm, on a if I'm doing my gratitude diary on a daily basis, after a point, it becomes easier for me to write that down. Previously, what would take me 5 minutes now it takes me maybe 5 seconds, because my brain has already registered. So even while I was having a bad day, my brain already registered all the good things that happened that day, right? So this again, like I said, it's a very healthy attitude, and that's what makes a positive attitude and a positive reaction, and a just positive outlook of life. Just simply saying all is well is not something that you even kind of can agree, because I can't lie to myself. No, all is not well, I just had a fight with somebody, right? But at the same time, I'm saying that yes, I had a fight with somebody, but life is good overall. So that is a very realistic thing that my brain is going to accept, that हाँ ये सही है, right? So again, we do need to, when we talk about positive affirmations, we want it to be reality based positive affirmations. That if I'm worried about exams, I'm going to tell myself, no, no, I will pass. No, I would rather say, because that would be more believable and I'll accept it and feel better and self-soothe, I will say that I've prepared a lot and I gave my exam very well. You know what, I think, I don't have a doubt, I'm going to pass. So let's wait and watch for the results and things. That I will accept, that kind of reassurance I will accept from me. So yeah, and and at the same time, of course, on a daily basis, if we are expecting too much from ourselves and we are setting too high a standard, oh, मुझे तो कभी गुस्सा आना ही नहीं चाहिए, I should never have a bad day, or I should always speak nicely to everybody. Those are again unrealistic standards, not possible for us to, kind of do. That's why it has to be sustainable goals, it has to be attainable goals, and it has to be appreciated by you. And nobody's perfect, nobody expects you to be perfect, you don't want to be perfect. When to see a psychiatrist, right? I usually add this slide because everybody asks. So a friend of mine used to say, खांसी या उदासी 15 दिन से ज्यादा हो तो डॉक्टर को दिखाना है. So now, because it's COVID, we are telling you don't wait for 15 days for Khasi. Having said that, but if you do see certain changes, like I said, a change of pattern in mood, thought, behavior, lifestyle, functionality of any other different kind, then definitely you might want to see a psychiatrist or psychologist who's qualified to do a diagnosis and get it diagnosed. Don't self-label, because it's not a great idea to just assume you have an illness. So again, general management of anxiety disorder, what do we do, right? So we talked about the healthy lifestyle, which is a very, very important aspect. The first time I have a patient, I'm going to diagnose and everything, but I'm going to say that, agle 15 dino tak, you do this. You come back and tell me that this is the healthy lifestyle that you've decided, and you've managed to do this for 15 days, and you think you can manage to continue this forever. So this is something that is the first step, the healthy lifestyle, right? But before that, what we would definitely want, and one of the goals for talking to you today, is early detection. If, it's just common sense, isn't it? Any illness or any disorder or any problem in your body, if you allow it to continue and become chronic, it's going to take that much longer to get better, and it would have already created that much more damage, isn't it? So the same way, if we have an early detection of anxiety and anxiety disorders, then management becomes so much easier. Then we are not looking, there's not an increased risk of substance abuse, there is, a decreased risk and chance of depression. मतलब एक बीमारी ठीक है ना, दो तीन क्यों हम add कर रहे हैं उसमें? And, so the outcomes, like the prognosis is better and the outcome is better. So of course we want to do early interventions and early detection. Yeah, because we don't want to take a chance that the anxiety was the beginning of other illnesses. So what do we do in terms of medications? Definitely medications that we have that are evidence-based, that are proven to work in anxiety. The way we talk about all mental illnesses is not that they're curable. We say they are treatable. Just because, again, we're talking about very realistic approach. I may have anxiety today, I get better. Maybe 10 years I don't have anything. Maybe after 10 years I could get another episode, isn't it? That's why we say it's curable. Just like for cancers, we say it's treatable, and we not that, oh, you're completely cured, but you're still continuing to screen and continuing to follow up with your doctor. So the same way, most of these illnesses, we would encourage everybody to use the word treatable, because that's a more realistic approach. And a combination of therapy and medications is something that is going to be so much more beneficial. We unfortunately see a lot of people who can't afford therapy, and because at least they can afford medications, because there are more doctors available who are going to do their see them in a shorter period of time. We're not going to charge them too much, whether it's a general OPD, whether it's a government setup, whether it's a charitable hospital, or it's a municipal setup. So at least medications are something that at least they might have access to, but therapy is not something that a lot of people have access to, which is unfortunate. But what's more unfortunate is that there are a lot of people who do have the means for it. The affordability, the accessibility, but they don't see they don't think it's going to work. And I'm sitting here, I'm telling you, there are a lot of evidence-based therapies like CBT and REBT and DBT that are very effective in anxiety and panic attacks. And it's important for us to kind of remember that and do this. Sometimes, if it's a mild to moderate case of either anxiety or depression, only therapy is also okay. But if it's moderate to severe, no, you do need a combination of medications. So what I'm going to tell you is that don't have a preconceived bias against therapy or against medications, because trust me, there are a lot of people who have कि बातों से क्या होगा, और वो बातों के इतने पैसे लेते हैं. It's not बातें. It is not just that. if you go to a proper private, a therapist who's qualified, who knows what they're doing, it's a very structured approach. Occasionally, it may seem like chit chat, but trust me, it's not. Of course, there are a lot of counselors who may not be qualified and call themselves counselors and who may be doing a lot of chit chat as such. So you want to be sure that who you're going to is not only just qualified but also talented. What can we do if we know that somebody in our circles, in our loved ones, if they have anxiety, right? When they're coming to us, when they're telling us, we want to encourage them to talk. We want to have empathetic listening, where we are not just going to listen to them because we are going to tell them something, but we're genuinely trying to see, okay, where are they coming from? Instead of saying, it's only just anxiety, yeah, why are you even behaving like this? And, oh, you've had anxiety for so long, so why is today a bad day and don't talk to me? So you want to listen, you don't want to judge. You don't want to say that, oh, you always do this and that's why. Who told you to go out? See, now you got triggered and now you have anxiety. Now I have to sit and listen to you. So you don't want to do all of those things, you know. It's possible for you to get a little frustrated maybe sometime, but at that time when somebody else is going through something, might not be the time to express it, because that will then further increase the crisis instead of helping it, right? And if you do know somebody that you want to be there for, you can tell them, you know what, get in touch with me. If I don't pick up the phone, don't worry, I must be busy. I'll call you back or leave a message and I will reply to you definitely as soon as I get the time. So you also don't want to kind of over promise where you are saying कि हाँ हाँ कभी भी phone कर लो मैं उठा लूंगी. नहीं शायद possible नहीं होगा, right? So again you want to be very realistic, because you don't want to lie to them, because that will make them more confident in approaching you, you see. So it's not just about oh, but I want to be nice. Like, be nice where you can actually deliver and show up. So let them know that you know that you understand, in the sense that not that you know what they're going through. Say that I can see that this is bothering you. So but when we say that, yeah, I know exactly what you went through and I know exactly what you're going through, that's very insensitive for somebody. Because no, you don't have anxiety as a disorder. You don't know what I'm going through. Like if you told me that, oh yeah, you're having fever, even I had fever, I know what you're probably going through. Again, if I had typhoid fever and then somebody's talking about malaria fever, very different, isn't it? So the same way, if somebody had a bad day versus somebody who has an anxiety disorder, very different. So subtle differences, but very, very important differences. So they're not just semantics. There's something that you want to kind of like recognize, that these are the words that you want to use and not want to use. And when you and the reason that I also say that don't overpromise is because sometimes these conditions can take a while to get better, and you want to make sure that you can be there, right? That your support is also sustainable, right? So it's important for you to not kind of overshare, overextend yourself if you don't think it's possible. And if the day, if suppose, like a lot of the times, somebody suffering from a mental issue or an illness is very supportive of somebody else. So we tell them, you need to draw your boundaries. If you're having a bad day, it's okay for you to tell your friend who's having a panic attack that, listen, I'm having a bad day, so today I can't help you. Why don't you try this, or why don't you call up that person? And because you want to take care of yourself as well, right? So there are going to be, again, like, times when you think it might be, keep going forever. But like I said, anxiety is treatable. And if you encourage them to take help and they do take help, it's better. Because a lot of times, because you're so reassuring, they might just, at every simple thing, they will call you instead of then, self-empowering themselves with therapy and treatment. So you again don't want to become a crutch for them, and you want to keep encouraging them that yes, I'm there for you, but you know what, let's go ahead and make an appointment with a professional. So yeah, so this is something very, very important. Again, I can go on, and I am going to have words with Arushi because she did not tell me when it was 5:30, and that's why I went on for a little longer. So it's all her
I
fault.
did. Sorry. I did text you. I thought you were seeing the message, so I didn't want to interrupt you in between.
I'm a very, very, I don't look at my cell phone if I'm doing something else. Now, just kidding. It's okay. It's fine. Like I said, it's entirely like my fault. I do go on, and I'm not going to see my cell phone when I'm doing a presentation and talking to the lovely audience today. Right. So we do have sufficient enough of time to have Q&A if that's what you like, or discuss or share. Of course, because it's my fault that I ran, 10 minutes more than what I would have liked to, I wouldn't mind staying a little more. So yes, please. If I don't know how you want to do it, Arushi, you want to read out the questions, or do you want me to go through the chat?
Ma'am, the participants can themselves read out the questions, so if they like me to read, it's fine. There are comments on the chats though you would want to go through.
Uh, well,
Anyone would like to
but
ask?
तारीफ लिखी है ना मेरी, then I will go through.
Yeah, there. Yes, there are.
Right, right. So yeah, please, people, go ahead. And
Audience, the mic is for you now. Please go ahead and ask ma'am questions.
somebody messaged me directly, but might not be for me, that they want the link for feedback form. So that might not be for me, that might be for the organizers.
We'll send the feedback form in 5 to 10 minutes. Like you guys can ask the questions and I'll send it on the link.
Shabna,
Assalamu alaikum.
Walaikum assalam.
Just wanted to know, this is the first session I'm just attending it. Alhamdulillah, it sounds good and it's really informative. What is my question is, I feel myself that I'm going under this kind of anxiety because of my personal issues. As I'm undergoing with a lot of stress and problems in my personal life, I feel that my confidence level is going down. As I was an English teacher for 14 years, I was working, I was very much confident, but due to my personal issues, I had to remarry because of my marriage. I don't know that this 2 years of marriage has put totally down, and I am not able to come out of my anxiety or depression. What would I say? I'm trying to cope up with reciting Quran, namaz, whatever I can do, I'm doing it. But still, I'm unable to come out of it, maybe because I'm very much stressed or very much thinking about it, or I really do not know what exactly I have to go through. Or I have what would be the outsource for me to overcome it or come out of this kind of anxiety, whether I am in a depression or whether I'm in an anxiety, or it is just an illusion, or maybe because of the problems I'm not able to fight the problems, or what I do not understand. And I'm also trying to take a course in emotional or being happier, and just to see myself where I can put myself busier, and where I can just keep myself healthy, and so that I can just move on and take back my confidence level which I have lost it. So that's what I'm trying to do, because this I just got up a message in my email. So I thought of taking up a session with a psychiatric. I think it will be also helpful for me. So that's the reason I was here. And I'm here right now listening your session. Alhamdulillah. Little bit I understood what it is, and maybe I'll just go through. I've just taken the screenshots of yours, and I'll also go through with that, with the comparative with the emotion sessions where I am taking with the psychiatric courses I'm taking. So maybe I'll just compare with that and see whether how much I can change myself, or whether I have to change, or whether I'll get back my confidence. I'll hope for the best. What will come up, inshallah.
Inshallah. Jazakallah khair. Thank you so much for sharing. I understand it's not always very easy for us to open up and ask and share from our lives, isn't it?
That's
So what we want to understand is that whether we are talking about depression and anxiety as an illness, right? If it's a disorder, it's because of it will happen to me if I have a genetic predisposition for it, if I have a genetic vulnerability for it. Now, I may ordinarily be okay with it. Having said that, if there are external circumstances which are maybe very, very stressful or been going on for some time or something like that, then those that my genetics, which are because of which I have an vulnerability of this disorder, then I can have a disorder, right? So now, whether I have a disorder or not is something that I will encourage you not to self-label, but to actually get a diagnosis from a qualified mental health professional, which is a psychiatrist, or in some cases, a clinical psychologist, right? And once we have a
I have gone for, I have visited a psychiatric and also asked because my husband used to tell me that you have gone mental, you have gone crazy, you have to, you are a big, you are a psycho, like that. He used to just give me a frame tag. So with that, I felt myself, and I went to the psychiatric and I told him that these things are happening, and he said, "You are very much fine, but what you have to do is you have to go for a marital marital counseling."
so,
He said it's only marital counseling you have to go, otherwise you are quite okay, normal. It is issues between husband and wife, not taking like husband and wife is not understanding or maybe not cooperative. Maybe it is that is the aspect what you are undergoing. It is not that you are a psychic or you have to get a treatment or you need a medication for this aspect. I have went across for that also,
allow me to
and
respond. I would, if you allow me to respond, that might be more
please,
beneficial for everybody
please,
who's listening
yes,
here.
please.
So I'm happy that you went to a psychiatrist and you don't have a diagnosable illness, which is great. Having said that, and if the psychiatrist has mentioned that marital therapy, that's great again. So the concept that we follow as far as stress and managing stress, which has caused distress in our life, is that, it's like self-defense. If you can run away, run away. If you can't run away or don't want to run away, scream and shout and ask for help. If you can't do that, then kick the culprit in the legs and then run away, right? So it's the same thing. If we can change our circumstances, maybe we could. If we can't, then we ask for help. Or then if you can't, then okay, yes, definitely, then turn away and go away from somewhere. When we talk about changing in therapy, we don't say things like, "Oh, you should change," or "You have to." Say is that, okay, there may be certain behavior patterns, thought patterns, and emotional patterns that are not helping you currently, that are not making your life easier. So you need to change those patterns. Don't change who you are, but just maybe change how you're reacting to a situation, and start responding to it and adapting to situations. Not to say that you should adapt to trauma, not at all, right? We are not encouraging people to remain in abusive or relationships or environments where it's going to be that's never ending, right? If I'm in an abusive relationship and if my partner is abusive, that's never changing. So my first thing to do is to safeguard myself and get myself out of it. But again, it's easier said than done, especially in our in our country, in the context of the frankly South Asian subcontinent in itself. So if in a lot of the times, if couples therapy is not possible because a partner might not agree, and if a partner agrees because of their pre-existing personality, or maybe they have a psychiatric illness themselves, it's not going to be therapeutic or might not going to have a positive outcome. You can still take therapy in terms of learning your coping skills better. I would encourage you to
Mhm.
therapy yourself first before
Mhm.
starting to kind of take courses which might not be very, very helpful, because these courses
Mhm.
are not really designed for your own therapy, isn't it? They're more of as if almost like an initiative or an introduction to a topic. So
Mhm.
you might think that that's enough, but you have to decide whether it is. So I would encourage you to go through the process yourself.
Mhm.
If you, and sometimes it might take a little while, because people go from therapist to therapist sometimes because they're not really finding that they're working very well with them. Doesn't mean that the
Mhm.
therapist is wrong or there's something wrong with you. It's pretty possible that it's not a good fit, which
Mhm.
so you need to kind of find the person. Like I tell people, I just can't go to any random guy. And I need to go to my
Okay.
own, right? So it's a very personal relationship. So go ahead
Yeah.
and do that. And I am going to encourage you to never give up on yourself. Even if you think
Thank you.
it's been going on for so long and I'm tired and this is going on, but you know what? Take a break, but then restart again, right? Self-help is something that you can never stop.
Never.
So the same way, I tell people that you need to do whatever you need to do. And taking treatment for yourself is self-empowering, because you are taking care of yourself. Your body is going to reward you also and going to get better. So in short,
Mhm.
if you need any help in terms of finding somebody locally, I'm happy to connect you and refer somebody if that's what you need. Yeah, and best of luck.
Inshallah, I'll get in touch with you. Jazakallah khair.
My pleasure. So somebody asked me in a direct message that trauma bonding and coming out of toxic relationships, any tips? Um, Trauma bonding is a concept where it's a so what happens is that because we've gone through traumatic backgrounds, like maybe there was abuse in my parents' relationship. Maybe they didn't abuse me, but I saw abuse on a daily basis, verbal, physical, sexual, and all abuse is psychological and emotional abuse. Maybe even if I've seen that abuse, that has also impacted me. And so my attachments, right, to myself, to people around me is a little abnormal. So what I will consider as like a healthy, robust relationship might actually not be very healthy. So none of my relationships will work out with the same amount of peace and happiness that I will find. And if you have recognized, like I said, that you are in a bad relationship or an abusive relationship, get out if at all possible. Right now, when I'm saying if at all possible, I'm not discouraging anybody to get out of it, but I do have to be very practical, and certain social situations might not be make it very possible for you to get out now. And the reason I'm saying if at all possible again is not to say that you shouldn't get out. It's just that even if you can't get out now, but it's okay, hold on, and maybe something you could do later, and all of that. Because when we are seeing people, whether that's in a professional or a personal capacity, and they're in a bad relationship, I do need to just stay the course with them, right? Whenever they are ready to get out, I'm going to be there for them. So I can't just say that, listen, your solution is to get out, and if you're not getting out, it's not my problem. I can't do that, because they have their own journey, and they have their own time, and they have their own reasons for getting out when they want to get out. So again, I'm not discouraging anybody from getting out, but I'm going to say that even if it's taking you time, don't worry about it. And self-compassion is the first compassion that you need to learn. And because sometimes we are so good about being compassionate to others, but we don't really treat ourselves the same way. So I tell people that you need to start with that. Even if your self-esteem is at a point that you don't like or love yourself, okay, but can you at least be kind to yourself to begin with? And then you can improve and become have a healthier self-esteem and self-confidence, which is great. So yeah, let's just be kind to everybody and to ourselves. um right, somebody's asking, is migraine related to stress or negative thought? So migraine is a neurological event which can be triggered, and usually is triggered by certain aspects, including if I haven't slept last night, I might get triggered. If I have too much of stress, it will get triggered. If I ate something that doesn't sit well with me, for my migraine, it will get triggered. I might not get indigestion, but I will get a migraine attack. If I'm going out in bright sunlight and it's in my head, it's in my face, I'll get triggered. Bright lights, everybody has those ring lights now to take selfies. Sometimes that kind of can trigger as well. So different people, so it's a trigger. So it's not a cause. Just like our stress in our lives is a trigger that might, start off my anxiety or depression disorder, but not, it's not a cause for it. So yes, definitely. Somebody else is asking me in a direct message, how to motivate oneself in a situation where everything is working in the reverse direction, how to find my own some potential. I'm thinking there was a typo. Um, so to begin with, when we do say things like everything is working in reverse, stop right there. That's a blanket statement. Don't use a blanket statement. Everything is not wrong, right? So even when we are seeing so many COVID deaths around us, right? Some of them are COVID deaths, some of them are oxygen deaths, some of them are, some other issues really. So not everything is wrong. Not everybody's dying. Not everything in my life is wrong, right? So that's a first step to do. Never use blanket statements, especially when you're describing something bad, whether that's in you, whether it's in your life, whether it's a situation, or even when if it's a movie, right? Even like, kya stupid movie thi, but cinematography bahut achhi thi, just because you have spent 3 hours and so much of money watching it, so you might as well like not be like that. Of course, I'm joking, but like I said, not using blanket statement. Trust me, there's one patient of mine, he followed up after like a couple of years because he had migrated and everything. He's like, madam, aapki wo ek baat hai na, usse mujhe bahut farak pad gaya. And he was a patient for 9 years before that, had gone to multiple psychiatrists and everything. And then he had, started medications with me, got better, everything was fine. We stopped medications. And that one statement, he doesn't remember much, but he remembers that one statement. It's like every time I have a fight, or if I'm in a stressful situation, I tell myself that this is bad instead of saying everything is bad. That's one way of kind of not getting disheartened, and like you said, finding potential within yourself or within that situation. And if you think that you still, you even in spite of so many adversities, but you still have something within you that you can go on and you can struggle and achieve whatever it is that you want to achieve, you're already halfway there, you've not given up, so that's a good thing, isn't it? So, and again, what are we even giving up on, right? Are we giving up on ourselves, or are we giving up on the things that we want? Whatever those ambitions could be, personal, professional, financial, social, whatever it might be. So why would we want to give up, right? We might take a break, we might feel even a little disappointed and a little disheartened occasionally, but we won't give up. So that's a good thing. So taking short breaks is better than believing that, oh, nothing can happen, right? And if you find yourself in that precipice where you feel nothing good is happening or nothing good can happen, yes, maybe you do need mental health help at that time, because maybe your cognition is distorted enough that nothing seems there seems no ray of hope, right? So ideas of helplessness or hopelessness or worthlessness कि कुछ ही अच्छा नहीं हो सकता है could be a sign of depression, and is impairing your judgment in terms of what can be done or what should be done. Yeah.
There's one more question in the chat box. If a person is having anxiety issues, along with diary entry, breathing exercises, meditation, healthy diet, what else should be suggested?
So if they have, like I said, anxiety issues and a healthy lifestyle and meditation and all of that is not helping, then it's time to upgrade your health, right? So self-help is not working, so you might want to upgrade to professional help and take help. If like I said, again, if you're diagnosed with a disorder, the approach is different. If you're thankfully not at a disorder level, but you do have a lot of disturbances and distress with it, then some amount of counseling and therapy. There's a difference between counseling and therapy, where you learn how to, you learn better coping skills in terms of, when like in CBT, cognitive behavior therapy, where we're talking about your thoughts leading to emotions, leading to behavior. So if you learn certain coping skills, that's also maybe good enough. So yeah, if apart from healthy lifestyle, if things are not working out, upgrade the help that you're taking. So I'm going to take a last question, because that was again directed to me privately and not to everyone, because they're messaging me directly. I'm not taking their names. As my husband's suffering from OCD, he's not tested, but all symptoms, how to cope when he's not willing. So unfortunately, even in cases where there is insight. Insight means I'm aware of what's happening, right? If I have, let's say, schizophrenia or bipolar, I might not have an insight something's wrong with me. But if I have an illness like OCD, it's possible that I have an insight and I understand that this is OCD. So, but if people are not, if you have noticed that there are symptoms, and if you try to speak to him and he hasn't agreed, maybe there are a lot of kind of tests that are available online for free that he could maybe do a screening test. These are not diagnostic tests, these are screening tests that he could do, and then you could convince that, see, this is also suggesting that you might have some problem, and it is treatable, so let's go ahead and do this, because you know why, this is impacting you and this is impacting the family, so so you might, and like I said, you do it again and again and persistently, whenever and however you can. Now, suppose that's not happening, or you don't think you have the kind of the vocabulary to kind of address it, maybe bring it up with the general physician or the family physician and suggest that this is what I'm suspecting, and what do we do? How do we go about it? Speak about it in front of your husband, so that your husband doesn't think that, oh, you're going behind their back, and your husband's not accusing you that, oh, mera naam kharab kar rahe ho, because even now people, stigmatize mental health ke, like just like the first speaker said that, मुझे बोला कि तुम्हारा दिमाग खराब है, kind of a thing, right? So we don't say कि ओ तुमको डायबिटीज है, तुम जाओ अपनी दवाई खाओ. We don't talk like that, but we say that, oh, तुमको depression है, तुम दवाई खाओ. So unfortunately that's still there. Until the time we don't accept the medical aspect of it, we're going to be stigmatizing each other by saying that, if I have an advance directive कि अगर मुझे डिप्रेशन होगा मुझे ये दवाई दे देना, अगर मुझे स्किज़ोफ्रेनिया होगा मुझे ईसीटी दे देना, अगर मुझे ये प्रॉब्लम होगी तो मुझे ये साइकियाट्रिस्ट के पास लेकर जाना, because I am like, Baba, this is my advance directive, this is my health, why am I going to take chances with it? So if we have that kind of acceptability, it will be easy. If he doesn't think that there is going to be stigma attached or people are going to laugh about it, Or there's sometimes even a fear of confidentiality. Trust me, most psychiatrists that I know and most psychologists that I know are very good about not breaking their confidentiality. I have people coming from my neighborhood, and my parents or my family or my sister or whoever, they don't know that they have come to me. I am treating my friends' relatives and my friends themselves, and my other friends don't know. We are very good about keeping confidentiality, not because of stigma, but that's, what, every medical professional is supposed to do that. My general physician is not supposed to tell everybody that I have blood pressure or diabetes or even cancer for that matter, right? So this is supposed to be for every medical professional or a paramedical professional. अगर वो nurse भी आ रही है मुझे सुई देने के लिए, तो she's also not supposed to tell everybody that she's coming for an injection. So trust me, if you hold your medical practitioners to that kind of expectation, they will reassure you that, yeah, this is going to be fine. So yeah, maybe he has a lot of apprehensions because of it. Keep at it, try rational language, be very patient, say that, this is not something he can see a psychiatrist, you can wait outside. He doesn't need to tell you what medications he's been given or whatever works, inshallah. So
Take any more questions?
oh well, that was the last one that I was going to take. So somebody is asking for my contact number. So I had shared my contact before, but I will share it again just in case somebody hasn't taken it. This is the mobile number that you can reach. My clinic or my assistant will answer. We work between 1 and 8. So before that, we might not respond. We don't work on Sundays. So yeah, I'm very easy to Google, honestly, because there's only one Ruksheda. So not just because of that, but also my spelling's a little different. You can find me on Facebook. You can find me on Instagram. You can even find me on Twitter, though I'm not very good with Twitter and I might not answer you there. Sorry. So I'm done.
It was a wow session. It was such a zestful webinar, and your presence is so vibrant, ma'am. Very well explained the difference between stress and anxiety. And there are a few of your quotes, I think, so our audiences and even me, we will always remember, like, the healthy lifestyle is not a treatment for any disorder. Like, people generally think that, a healthy lifestyle, will, you have a healthy lifestyle and all your problems will go away. So it's not that simple. The other one is this khasi ya udasi 15 din se zyada ho to doctor ko dikhana chahiye. I think I will surely remember this, and even the audiences will remember this. Very nice that you highlighted what the therapy is, and it's not just batein. And you covered almost everything about anxiety. Thank you so much, ma'am, for taking your precious time out from your busy schedule. We know that how busy you are, and it's an honor to have you, address our audiences. And one more thing, I want to make a mention of is that, when you said, be compassionate to yourself first. Wonderful. Thank you, ma'am. Thank you so much.
It's a pleasure being here. Bye.
Over to you, Arushi.
Oh, okay. Sorry.
It's 2 minutes.
So, so thank you so much, Syeda ma'am, for conducting this workshop so wonderfully. The session has been really insightful for all of us. You very practically, and illustratively broken down the term anxiety and its wide-ranging forms to all of us. So we all will surely be taking something back with us today, thanks to you. And yeah, I would also like to thank all the participants for taking the time out. I hope you all have something to take back from today's workshop. And yeah, also NurtureLife tele helplines are open for people in need. Feel free to contact our team. And before we close, I'd like you to remind you to please fill out the feedback forms before midnight. So thank you so much for everybody.
Bye.
Bye bye.